Welcome to the deep dive. We take complex information, stacks of it sometimes, and boil it down to what you really need to know. Today, we're looking at something pretty amazing. That journey a baby takes from the womb out into the world. It's this incredibly fast, really complex adaptation, and honestly, it often goes underappreciated.
It really is incredible. So our mission today is to sort of decode what's happening physiologically with a normal newborn right after birth.
Yeah.
We've dug into a very detailed medical guide focused on newborn assessment. We want to pull out the key things, the really significant bits, so you can quickly grasp what matters most in that initial checkup.
Exactly. The source material we used is super comprehensive. I mean, it covers everything, vital signs, a full head-to-toe exam. It gives you the whole picture, what's normal, what's kind of remarkable about those first few moments. So where do we start with this transition? Well, when that baby arrives, there's this immediate, rapid assessment, right? Almost like their first little test. That's the APGAR score, isn't it? Done at 1 minute and 5 minutes.
Spot on. 1 in 5 minutes. And it's incredibly efficient. It gives this instant snapshot of how the baby's doing with the transition. The scoring is pretty straightforward. 0 to 3, that signals severe distress. The baby's really struggling.
Okay.
4 to 6 indicates moderate difficulty. But if you get a score of 7 to 10, that's great. Minimal or no difficulty adjusting. It really guides the immediate care needed. Like, how much support does this baby need right now?
It's amazing how much a few numbers can tell you. And speaking of numbers, let's get into some of the typical measurements for a term newborn. Weight, for instance.
Yeah, weight. Generally, we're looking at 2,500 to 4,000 grams.
Which is what, about 5.5 to 8.8 pounds for most people?
Exactly. And then length is usually in the range of 45 to 55 centimeters, so maybe 18 to 22 inches.
Okay.
Head circumference, that's typically 32 to 36.8 centimeters, about 12.6 to 14.5 inches.
Right.
And the chest circumference is usually just a bit smaller than the head, around 30 to 33 centimeters or 12 to 13 inches.
Gotcha. Now, those numbers are useful, but the context of gestational age is really important too, right? Can we just clarify those terms?
Absolutely. So term is defined as a baby born between 37 weeks and 0 days, right up to 41 weeks and 6 days.
Okay.
Preterm is anything before 37 weeks. And postterm is born after 42 weeks.
Right. And how does that connect back to the weight measurements?
That's where we get into classifications like AGA, SGA, and LGA. AGA means appropriate for gestational age. Their weight is between the 10th and 90th percentile for their specific gestational age. Pretty much on track.
Okay, that makes sense.
Then you have SGA, small for gestational age, which is below the 10th percentile. And LGA, large for gestational age, is above the 90th percentile. And this really matters because it helps anticipate, the baby's growth path and flags potential health things right from the start. It's part of their initial story.
It really does give a much fuller picture. Okay, so we've got that first snapshot with the APGAR and the basic body measurements, but the baby's condition isn't static. What are the ongoing checks? The vital signs that tell us how they're coping moment to moment.
Right. Those are checked quite frequently at first, on admission, obviously, then usually every 30 minutes twice, then every hour twice. After that initial period, it's often every 8 hours, but, that can vary depending on the hospital unit.
And what are we looking for? Respiratory rate?
Yep. Respiratory rate should be between 30 and 60 breaths per minute. And it's really important to count for a whole minute.
Why a full minute?
Because newborns often have something called periodic breathing. They might pause for a few seconds, and that's normal. But if the pause, the apnea, lasts longer than 15 seconds, that definitely needs to be checked out.
Okay. That's a key distinction. Cariotic breathing is normal. Got it. What about heart rate?
Heart rate, we listen with a stethoscope at the apex of the heart, the apical pulse, also for a full minute. The range is 110 to 160 beats per minute. Now, here's something that sometimes surprises people. Blood pressure.
Oh.
While there's a typical range, 60 to 80 systolic over 40 to 50 diastolic, it's actually not routinely checked on healthy, normal newborns.
Really? That is unexpected. Why is that? You'd think it would be standard.
Well, for a healthy baby who's transitioning well, other signs like heart rate, breathing, their color, their perfusion, how well blood is circulating, those give us more immediate and, frankly, more useful information about their stability right then. Blood pressure can be a bit variable right after birth, maybe less reliable as a primary sign compared to the others. So it's just not part of the routine screening for every single healthy baby.
Okay, that makes sense. And temperature?
Temperature is crucial. We're looking for 97.7 to 99.5 degrees Fahrenheit or 36.5 to 37.5 Celsius. and axillary under the arm is the preferred way to take it.
So staying warm is obviously a big challenge for them. Let's talk about thermoregulation. That idea of a neutral thermal environment sounds really important.
It's absolutely critical. Newborns are not like us. They have a special way to generate heat using something called brown fat. It's called non-shivering thermogenesis.
Non-shivering.
Yeah, they generate heat without shivering like adults do. Their muscles aren't developed enough for effective shivering yet. This brown fat is like their own internal heater, but it's a limited supply. And they can lose heat really easily through evaporation, convection, conduction, radiation. Basically just being exposed.
So they're very vulnerable to getting cold, what's called cold stress.
Extremely vulnerable, especially if they're preterm or small for their gestational age or have other health issues.
So what are the signs if a baby is experiencing cold stress? And more importantly, how do we prevent it?
Signs might include an increased respiratory rate as their body tries to work harder. Their skin might look mottled or pale. They might become lethargic. Prevention is really key. Drying the baby thoroughly right after birth, wrapping them warmly, putting a hat on, skin-to-skin contact with the parent. All nursing care is focused on minimizing heat loss, maintaining that neutral thermal environment. Supporting that unique brown fat mechanism is fundamental.
It really highlights how different their physiology is right at the start. Okay, let's peek behind the scenes a bit at some lab data. There's a whole panel, but maybe we can focus on a couple that are often watched closely early on, like glucose and bilirubin.
Good choices. Yes, glucose is vital.
Yeah.
The normal range is roughly 40 to 60 milligrams per deciliter. Newborns don't have big energy reserves, so low blood sugar, hypoglycemia can happen quickly and potentially impact brain function. It needs careful monitoring, especially in at-risk babies.
Right. And bilirubin, that's related to jaundice, isn't it?
Exactly. Bilirubin is the substance that causes the yellowish tint of jaundice. It's normal for bilirubin levels to rise a bit in the first few days as the baby's liver gets up to speed processing old red blood cells. But we track it closely, knowing the typical ranges like maybe 2 to 6 at 24 hours, 6 to 7 at 48 hours, then maybe down to 4 to 6 by days 3 to 5 helps us tell normal physiological jaundice from levels that might be getting too high and need intervention, like phototherapy.
So these numbers are like early warning signals for how their internal systems are adapting.
Precisely. They tell us a lot about their overall systemic health right then.
Okay, that's super insightful. Let's broaden out again to the full physical assessment. I assume keeping the baby warm is still a top priority during the actual hands-on exam.
Oh, absolutely. Maintaining that neutral thermal environment is constant, along with, of course, proper identification and safety checks. The exam itself usually starts with just observing a general survey. What's their muscle tone like? Are they flexed like a typical newborn? Skin color, how are they breathing? Are they alert, sleepy, crying?
Getting an overall impression first.
Exactly. Then we typically move head to toe for consistency, making sure we cover everything. And assessing newborn reflexes is a big part of it, too.
Right, those reflexes tell you about their neurological status.
They do. They give us important clues about their neurological development and readiness.
So, as we go head to toe, are there some particularly maybe fascinating or unique details we often see? Let's start with the abdomen, the GI, and GU systems.
Yeah, the gut is interesting. A newborn's stomach capacity on day 1 is tiny, only about 5 to 7 milliliters, like the size of a cherry or a marble.
Wow, really that small?
Yep. And it empties pretty quickly, usually in 2 to 4 hours, which is why they need to feed frequently. Key milestones we look for are the first stool, that dark terry meconium, which should happen at least once in the first 24 hours.
Okay.
And for the urinary system, at least one wet diaper, one void, also within that first 24 hours. It shows those systems are functioning.
Kicking into gear pretty fast then, despite the small stomach. Okay, from the inside workings, what about the outside? The external genitalia. Anything notable there that parents might observe or be surprised by?
Definitely. For male infants, we check that the scrotum is pendula sort of hanging loosely and has rugae, those wrinkles, which indicates maturity. We also confirm the testes have descended into the scrotum and that the urinary opening, the meatus, is right at the tip of the glands. Circumcision is, of course, a separate discussion.
Right.
For female infants, we expect the labia majora, the outer folds, to cover the inner labia minora and the clitoris in a term baby. You might see some vernix, that white cheesy coating in the creases. And then there's something that often catches parents by surprise: pseudomenstruation.
Pseudomenstruation. Okay, that sounds unexpected. What is that?
It's a small amount of blood-tinged vaginal discharge that can sometimes occur in female newborns a few days after birth. It's completely normal and harmless. It's just caused by the withdrawal of the mother's hormones that the baby was exposed to in the womb. It can be a bit startling if you're not expecting it, but it's just a temporary hormonal adjustment.
Wow. Okay, that is definitely a fascinating detail. And good to know it's normal. You really do learn something new with this stuff. All right, let's wrap up with some essential early care points. Feeding and safety seem paramount.
Absolutely. For feeding, especially breastfeeding, that skin-to-skin contact right after birth is so important for getting started. Proper positioning, making sure the baby has a good deep latch, those are key for successful feeding and preventing nipple soreness. Pacifier use is another topic that often comes up in relation to feeding.
Right. And for teaching parents, safe sleep is huge. What's the core message there?
The core message is simple and clear. Alone, back, crib.
Alone back crib.
Yep. Baby sleeps alone, no bed sharing, on their back, not tummy or side. And in a safety-approved crib, bassinet, or play yard, with a firm mattress and no loose bedding, no pillows, no bumper pads, no soft toys.
Crystal clear. Any other key teaching points?
One other thing that's become more common practice is delayed bathing, waiting several hours or even a day or two before the first bath.
Why is that?
It mainly helps prevent that dangerous heat loss we talked about. It gives the baby more time to stabilize their own temperature. Plus, that vernix coating has some protective properties for the skin.
That makes a lot of sense. Okay, so we've covered a lot of ground here. This deep dive really gives you a detailed but hopefully concise look at this incredible physiological journey and all the careful assessment that happens in a newborn's first few days.
It really does. And maybe a final thought to leave you with. Consider how all these seemingly small details, a temperature reading, a weight check, the timing of a first stool, how they all fit together. These precise measurements and observations in those first moments, they really lay the foundation for understanding a baby's health and development trajectory. So what does diving into these early stages of life make you wonder about the amazing design and, frankly, the resilience of the human body right from the very beginning?